let's talk about that nagging stomach pain. You know, the kind that leaves you lost in a sea of confusing medical terms. Well, if that sounds familiar, you're in the right place. Today, we are going to clear things up and really dig into two of the most common culprits behind that discomfort: dyspepsia and gastritis. Let's get right into it. To make sense of all this, we're going to walk through what I like to call the diagnostic funnel. We'll start up top in that wide, confusing world of symptoms. Then we'll narrow our focus down to two main suspects. From there, we'll look at the definitive tests that give us real answers. And finally, we'll land on what it actually takes to confirm a diagnosis. Okay, so first up, we're starting with a feeling that is just all too familiar for so many people. It's that deep frustration of having very real, very clear symptoms, but no clear diagnosis to go with them. This right here, this is where all the confusion really begins. So why is there such a disconnect? Well, it's because what you feel and what is actually happening inside your stomach can be two completely different stories. It's totally possible to be in a lot of pain with very little physical inflammation, or, on the flip side, to have significant inflammation and feel perfectly fine. This is probably the single most important distinction to get your head around. Dyspepsia, that's just the medical term for the collection of symptoms you feel. You know, the pain, the bloating, the nausea. Gastritis, on the other hand, is the actual medical diagnosis. It means your stomach lining is inflamed, and that's something that can only be confirmed with a medical procedure. And here's the kicker: you can absolutely have one without the other. All right, now that we've separated symptoms from diagnosis, let's start our investigation. It's time to bring in our first major suspect. Behind the actual inflammation, a tiny bacterium called Helicobacter pylori. For a huge number of people, this little guy is the root cause of their stomach problems. But here's where the journey gets a little tricky. See, it's not as simple as just finding the bacteria. A doctor can only officially give a diagnosis of H. pylori-induced dyspepsia after the fact, meaning if your symptoms actually get better once the bacteria has been successfully treated and removed. It's basically a diagnosis that's made in the rearview mirror. And this is a really crucial point for anyone going through this. It is not a quick fix. It can take up to 6 full months after treatment for your symptoms to completely resolve. That waiting period is so important to know about because feeling better requires some real patience, even when the treatment itself is working perfectly. So what happens if you've gotten rid of the H. pylori, you've waited patiently for months, but you're still not feeling better? Well, in that case, the diagnosis often shifts to something called functional dyspepsia. This essentially means that you've got all the symptoms, but there's no visible structural cause, like inflammation, that a doctor can actually see inside your stomach. Okay, so what if H. pylori isn't the culprit? Let's turn to our second suspect, an autoimmune attack. This is a totally different scenario, where your body's own immune system mistakenly starts targeting and damaging your stomach lining. Now, a key thing about autoimmune gastritis is that it can be a silent disease for a very, very long time. Often it's not stomach pain that brings someone to the doctor, it's actually the downstream effects, things like certain types of anemia that get discovered during what seems like routine blood work. And this makes a lot of sense when you remember that autoimmune conditions rarely travel alone. If a patient has autoimmune gastritis, there's a pretty good chance they have other autoimmune disorders too. The link with thyroid disease, for instance, is so strong that it was given its own name way back in the 1960s, thyrogastric syndrome. It's just a powerful reminder that these things are often part of a much bigger picture. So we've explored the symptoms and we've got our two main suspects. Now for the most important part: how do doctors get a definitive answer? Well, to find out what's really going on, we have to look at the gold standard tests. Now, not everyone with stomach pain needs to jump straight to an endoscopy, but if a patient shows up with any of these specific alarm signs, we're talking things like unexplained weight loss or trouble swallowing, the guidelines are very clear that an endoscopy is needed to rule out anything more serious. For H. pylori, there are also some highly effective tests that don't involve a scope. These are often used for an initial diagnosis or to confirm that a treatment actually worked. The two main ones are the urea breath test, which is considered the most accurate, and the stool antigen test. Both are great ways to spot an active infection. But at the end of the day, to truly see what's happening, to confirm there's inflammation, to figure out the cause, and to understand just how severe it is, an endoscopy with a biopsy is the only way to get the complete answer. It is the ground truth. And this brings us right to the bottom of our diagnostic funnel.
Those small tissue samples taken during the biopsy are sent off to a lab. And what the pathologist finds under the microscope, that is what truly confirms and clarifies the diagnosis. And just so you know, this isn't a random process. Gastroenterologists follow a very specific procedure called the Sydney Protocol. They take samples from 5 distinct areas of the stomach. This systematic approach gives pathologists a comprehensive map of the entire stomach lining so they can see exactly where and how much inflammation or damage there is. Now, when autoimmune gastritis is suspected, blood tests are also a huge piece of the puzzle. The best way to think about these 2 key antibody tests is with an analogy. The antiparietal cell antibody test, think of it like a wide fishing net. It's great at catching almost every possible case, so a negative result is very reassuring. The anti-intrinsic factor antibody test, on the other hand, is more like a spear. It might miss some cases, but if it gets a positive hit, it is incredibly accurate. Doctors use both to build that complete picture. So one of the key things a pathologist is looking for in that biopsy report is something called intestinal metaplasia. This is a major telltale sign of long-term inflammation. It's where the cells of the stomach lining have become so damaged that they've actually been replaced by cells that look like they belong in the intestines. It's a huge clue. You see, getting this definitive diagnosis isn't the end of the road. For a condition like advanced atrophic gastritis, the whole focus shifts to long-term management and surveillance. The goal is to keep a close eye on any changes over time, with regular endoscopies often recommended. So we've gone from a confusing symptom all the way down to a clear diagnosis and a plan for the future. We've covered a lot of ground. And look, the goal here isn't to make you a medical expert, but to arm you with the knowledge to have a more informed, more confident conversation with your doctor. Understanding the journey is the first step. The next is figuring out what to do with that information.